Hello and welcome to the Center for Medical Justice. I'm Dr. Joseph Parker, and today we'll be speaking with Dr. Linda Cheek. Dr. Cheek is a retired family practice and alternative medicine physician. It was her childhood ambition to be a physician, but this dream was delayed a bit as she spent 20 years as an Air Force wife and high school teacher. She was trained conventionally at the University of Texas Health Science Center in San Antonio and graduated at the age of 43. She completed her residency in family practice in Roanoke, Virginia, and started working in Southwest Virginia to help the underserved there. By her second year of medical practice, she felt that conventional medicine doesn't truly heal, but simply treats symptoms, somewhat maintaining the disease. So she took it on herself to learn alternative medicine practices, coming to believe that lifestyle changes and other modalities, including things like acupuncture and homeopathy, energy balancing, and auricular therapy, which I'm not familiar with, can help trigger the body's own regenerative processes, resulting in a more complete and true healing. Using her alternative knowledge, she took on pain management in an area of the country where there was also a high level of abuse and addiction. In the course of her practice, she was able to get people off opioids as their pain resolved through her treatment. And although physically dependent on the opioids because of years of use, patients were able to decrease and eventually eliminate their opioids without withdrawal symptoms. She was also able to help addicts be free of their addiction. She will explain what these are two different categories of patients, and that pain management does not equate to being an addict. As a result of the government's agenda against opioids, and in spite of Dr. Cheek's record of reducing opioid use in the area through these healing alternatives, she became a government target. Her book, Target Pain Doc, is a fictionalized account of the first attack on her practice, and there will be a link to this book in the description. Then, through what she describes as gross government misconduct, she was convicted in a second attack by what she believes to be the illegal use of the Controlled Substances Act. Now, that's not a big shock to those of us who are familiar with the government's actions in this area. As a result of this conviction in 2013, Dr. Cheek lost everything except her wonderful husband and family. She lost her only means of retirement, her office building, her career, her home, and her good name, as well as all the personal possessions that were in her home and office. She spent 26 months incarcerated in federal prison, where she learned that what had happened to her was now happening to many others and is in fact illegal. Her mission now is to achieve the exoneration of all innocent physicians attacked for doing what all of us are supposed to be allowed to do, which is treat the suffering of others. To that end, her primary website is www.doctorsofcourage.org. Her speaker author website is www.lindacheekmd.com. Her healing website is www.7pillarstototalhealth.com, and all of these links will be in the description. And she offers an e-course called Bringing Medicine to the 21st Century. Thank you for being here, Dr. Cheek, and please tell us about what you went through and what you've learned in the process.
Okay, sure will. Well, of course, as most people in America believe, before something hits them like this, we all think that our justice system is just. But we actually should be calling it now the injustice system, because it is a system where it's our whole country. Our country has just over the last probably 50, 70 years or so has just degraded to the point where we no longer hold the values of our founding fathers. Now it's all about the money. We've given up God. They even wanted to take In God We Trust off our dollar bills. We have left God. He has left us as a country. We are doomed, basically, in my opinion, as a Christian. And that also goes to show the apathy, the failure to actually do what needs to be done in this country. I give it to God, but then I say, God, I'm here if you need me, if you want me, if you can use me. But what I learned was that U.S. attorneys, the justice system basically, is about promotions. They found out through the Enron and Anderson fiasco in Houston, which you might be familiar with back in the early 2000s, that they can do whatever they want to convict whoever they want. And they can create a crime, and they did that then. And even though Sidney Powell wrote the book, License to Lie, exposing everything, no one who did any of that to force those companies to bankruptcy and to commit crimes that they did not commit, none of those prosecutors ever got punished. And not even in the sense of being, statements from the bar. It was all cover up. It was all okay. And basically it sent the word out to all lawyers, do whatever you need to do to convict whoever you want to convict. And so they're doing that. And basically they're using the Controlled Substance Act against doctors simply because they can. There are people who say we need to have a congressional hearing on the DEA. Sorry, folks, it's been done twice. And the definition of insanity is repeating the same thing over, expecting a different result. Okay. The first DEA hearing was in the 1990s, and that's actually where they started the attacks on us, because they were raked over the coals by Congress for not bringing home the bacon, because their job since the 1970s was to go after the cartels and get all that good cartel money and bring it to the United States. And what they found out was it's offshore. They can't touch it. Even when they put a cartel leader in prison, he gets out in a few years. So, it was a total waste. So a real smart U.S. attorney, Glenn Fine, said, oh, wow, we're giving the same prescriptions to people. Doctors are prescribing these same things we're tracing the cartels for. We can just go after the doctors. And so they used various propaganda-like statements about, like the Taliban, and, this was after 9/11, and they just used all kinds of propaganda against doctors, drug dealers in white coats, and all of this in order to convict. And basically it's worked. Propaganda now in the US, in the American mind, is going on now for 20 years. And even though the senators and the congressmen that existed in the early 1990s and actually sat in on that first DEA congressional hearing, they should know better. But because of the money, because of the politics, because of the the earning the people are getting, the jobs that are being given, it's all just I'll pat your back, you pat mine kind of thing. And they're ignoring the fact that all of this is illegal. I sat in the prison cells. I spent time in 2 prisons. I was at the good old Martha Stewart quote Camp Cupcake for 1 year. It's no Camp Cupcake, believe me. And because I made enough ruckus there, they literally set me up for moving me to SFF Hazleton. But that was a blessing, because at Camp Cupcake, you had to sit for 6 hours and do nothing because they had no jobs there. And yet you had to, quote, be hired, be working. So you just sat doing nothing. And whereas at USF Hazleton, they had jobs, but you had the choice of working at a job or being on your own. I chose to be on my own and spend all my time in the law library. And so by studying in the law library, getting all the records of all the doctors attacked, I began to see, and in also interpreting and reading the Controlled Substance Act, that we're not supposed to be targeted. We're protected by the Controlled Substance Act. And the only way that they're attacking us is by the misuse of the phrase for a legitimate medical purpose. And they're doing that, again, because the Americans believe that our system is just, that they wouldn't do anything bad. There's no such thing as misconduct in the Department of Justice. Oh, that's BS, excuse me. And so, I actually then came out smarter than I went in. Okay. And so then as soon as I hit the streets on December 15th or 16th, I think, of 2015, first thing I had to do was go out and walk in the freezing cold ground with my bare feet, because in prison you can't go barefooted. You have to always have your shoes on. And I love to be barefooted. It connects you to the earth. And I really miss that. So, freezing cold weather, I go running outside in the cold with my bare feet. But then, as soon as I came back, I'm not computer literate, really. And so I started off with taking courses on how to create a web page. And I did that. And in fact, I created my 3 web pages, or websites actually. And so then I've been just trying to get the information out to people that will stop this. And the fact that people don't want to learn it, don't care to learn it, they just want to sit on Facebook and gripe and complain, or just whatever it is. Again, I don't know the reason. God knows the reason. God might even be putting that into people to do, because of the fact that I think he's kind of put with the United States, and he's ready to see our demise. We need to go back to God, and I'm stating that as a Christian. I don't have any problems with other religions, or no religion at all. That's just my position.
I see. Now, when you were in the law library and you were studying the Controlled Substances Act, so it was enacted in 1970, and the first doctor, it was assumed to not apply to doctors because doctors would register, and that exempted them from that act. That act applied to those who were not registered.
Right.
And in 1974, there was a Dr. Moore who was, according to the government, selling methadone by the milligram or by the pill. They said he wasn't examining patients at all, wasn't really talking to them at all. And so that his actions were no different than a drug dealer, and they allowed his prosecution. Then the government extrapolated from that, and then have gone on to define the legitimate the legitimate practice of medicine as basically whatever they want it to be. Now, even if the doctor does a physical exam, they will pay other doctors to come in. They'll pay them hundreds of thousands of dollars to come in and say, well, that wasn't adequate for this medication on this day. And that's very persuasive to juries. What do you think can be done to help doctors? The Ruan decision should have settled the matter, but the government has twisted a loophole into it to where they can pretty much ignore it. What do you think needs to be done to give doctors some protection so that they can treat according to their education, training, and experience, while at the same time having some sort of a mechanism to police the doctors who are truly selling prescriptions or trading them for sex or doing things that are otherwise obviously illegal? Do you think that should be left to the states, and federal law enforcement could have jurisdiction over imported drugs and interstate commerce and illegal drugs, but not over doctors?
My position is that the Controlled Substance Act needs to be repealed, period. The war on drugs is a failure. If anybody has any sense and has had any experience in this at all, they would see that. And why it's continued for 100 years, irregardless of the fact that just prohibition shows that all the negatives of what happens when you make something illegal, like a drug, like alcohol. Alcohol is one of the worst abused drugs out there, and yet it's legal, and we are going to keep it legal because we know from prohibition that prohibition doesn't work. And what it does is it creates the poisonous alternatives, like methanol occurred. It creates stronger alternatives, like moonshine was created. It creates the black market. It creates the crime, like the Untouchables experience with Al Capone and so on. And all of this is because of the illegality. No drug causes addiction. And the problem with the war on drugs is that they basically equated drug use with minorities that they wanted to disenfranchise, and again with just propaganda. We're still using that propaganda today. I truly believe that is the propaganda against blacks and the use of cocaine that makes black men become dead bodies on the street when they come into any confrontation with a policeman, no matter how minor it is. Because in the mind of that policeman, they are thinking black men are high on cocaine, they are superhuman, they are dangerous, and I will use my weapon against them. Okay? And that's all because of the propaganda to try to keep blacks from being able to vote. This was at post-Civil War. And then also the minorities is the opioids were the targets to disenfranchise the Orientals that came into the United States to build the railroads. Okay, so everything is basically anti-minority, it's racist. And why we're still continuing it, except for the fact that today we now have the propaganda about that drugs cause addiction. There is no proof anywhere that drugs cause addiction. The medical science cannot say that drugs cause addiction. There are a few people out there who claim that there is a gene for addiction, but the problem with that, even if there is a gene for addiction, everyone in the medical science should recognize the fact that just because a person has a gene does not mean the disease is expressed. Okay?
Exactly right.
So the difference is what causes the gene to be expressed. Okay? And even if there is a gene for addiction, it's few and far between. Okay? It does not explain the 1% for hundreds of millions of years, 1% of people being addicted to something. Primarily alcohol was the big thing, even back, centuries ago. Alcohol might have been a problem. There's no explanation for how the gene is expressed or why it's expressed in just a few people. And now addiction is increasing exponentially. And for people who understand, exponential means for thousands of years, the direction was flat. The amount of the percentage of addictions was flat. And then suddenly when it becomes exponential, it suddenly starts rising. And then suddenly it's almost like going vertical. And we are now on that vertical climb. And so we now have addiction doubling at, let's see, when I first investigated it in 2020, approximately, it was doubling at every 9 years. And then it was supposed to be doubling by 2025. It's supposed to be doubling every 4 years. So in other words, I worked out a calculation, and in 2020, the percentage was about 1.5% of the population. So I figured, okay, by 2025, we're going to be at about 3 to 4%. And by 2030, we're going to be at 8 to 10% of the population addicted. Now, that doesn't mean just to opioids or just to cocaine. Right. It means all addictions, sex, gambling, you name it.
Nicotine, all of these. Even THC for some people, though it's much less common.
Right.
Now, it is a historical fact that the opium laws were brought about to, as you say, kind of oppress or hold back Asians who had come here to help build the railroads and had become had worked hard and were succeeding. Nothing will stimulate the ire of the American government more than a minority actually doing well. And so that's historical fact. And it's also a fact that the Attorney General of the United States, when the Controlled Substances Act was created in 1970, has said that it was created with the intent of suppressing the blacks, and he said the anti-war movement. Now the blacks
and the hippies.
Yes, the hippies. The black people he felt used heroin at a higher rate than the general population because they were using other drugs, and the hippies or the anti-war movement was more into cannabis. So by criminalizing those and putting huge amounts of money into searching, arresting, prosecuting, convicting, and incarcerating, you could dramatically damage those two communities, and they thought that would solve the problem. Now we're $3.2 trillion and 50 years into this experiment. Drug use is just as high as it's ever been. As you say, it's higher. The death rate has gone through the ceiling since they started their big crackdown right around the time that they came after you. Now, they were experimenting a little bit in your time. They were seeing what they could get away with. And as they got away with more and more, they kept making their actions more and more extreme. And you say they came after you twice. That's not uncommon because, one, it's much easier to convict someone after they've been damaged from the first time. And two, if you get away, if you go through something and succeed, they see that as an affront to their declaration that you are a terrible person. So if you're doing well, they're going to try to tear that apart again. And this is one of the few countries on earth where your punishment never ends. You go to prison and everything's a felony now. Everything requires incarceration now. And once convicted of a felony and incarcerated, you lose your Second Amendment rights forever. You lose your voting rights forever in many states. And you also become a target, meaning if they ever have an opportunity to do something to you again, you're number one on the list. Now,
Can I add something to that?
yes, please.
Yeah. Also, something that I just found out because I'm helping people. And through my church, I help people that are in need. Okay. And I have someone that is looking for housing, HUD housing, because she doesn't have much of an income. In my search for in HUD housing, I found out that if you are a convicted felon for drug dealing, like me, you are not eligible for HUD housing. You cannot go into a government subsidized home. So all these doctors that have had everything stripped from them, and even some of them, their families have left them, and they come, if I hadn't had my husband stick with him, even though he had family people and friend people say you need to divorce her, if he hadn't stuck with me, then I would have been on the street, living in a shelter, living in a tent, unemployed, and with no access to any type of housing at all. That something is wrong there. And that's something that needs to be corrected, especially when we get rid of the Controlled Substance Act and all of us are exonerated. But still, to say you're not eligible for a house provided to you at a reasonable price by the government simply because you're a quote drug dealer is just again another use of propaganda. So that's another offset of the Controlled Substance Act that you mentioned.
I would argue that that's exactly where they want you. That they don't want you to do well. They try to destroy your contact with your family. I mean, seriously, they've got 80-year-old physicians being thrown in prison. Dr. William Bauer, 83 years old. Dr. Hinderleiter was 81 when he went to prison with a 10-year sentence. Right? He had pled guilty.
Lifetime.
So quite often physicians think if they plead guilty, they will be treated better and have some chance of having a life. But this man's 81 years old. He pled guilty to one Schedule 4, which should have been a maximum of 5 years. But at sentencing, the government says, oh, but some of his patients died. And without having to prove that they died from medications he prescribed, he gets doubled to 10 years, which the judge, in all fairness, probably thinks that they're being just because they say, well, it's 20 to life if someone dies from medications, and this is a 5 year, so I'm going to cut it in half and make it 10, and I'm being fair. But the poor man died in prison, separated from his family after 80 years of serving humanity, or 60 years of serving humanity, since he was a veteran first and then went into medical practice. So it seems to me that right now, anything that affronts the federal government results in absolute destruction of not just your immediate life, but any future life you hope to have. A good example of that is when any cannabis-related conviction for a child would result in their not being able to receive federal loans. So the government's argument was, if you do something that we think is stupid, we won't educate you. I fail to see the logic in that argument. But what have you seen? Now, you have been fighting this fight longer than almost anyone else. Most doctors at the time you were attacked assumed that if a doctor was targeted, they were doing something wrong. Now there is a general realization in the medical community, and the AMA has finally spoken out on this, that not strongly enough, I don't think, but they've spoken out and said, this is unjust. And you see articles in the New York Times saying, get the DEA out of medical practice. And at this point, they are truly dictating the practice of medicine in violation of several laws that you quote, including 42 USC 1395, which says that the federal government cannot even try to influence the practice of medicine, the federal government or any employee or agent thereof. Do you think that congressional action has any hope of improving this I think the medical community has been a complete failure of standing up for its, you know, for its colleagues. Everyone runs scared, and even when they know you are absolutely innocent, they are too scared to say so, afraid they will be targeted. And that makes me really fear for this country.
Mhm.
Did you experience some of that? Did you have any colleagues that stood by you, or did most of them run the other way?
Oh, I didn't have anybody stand by me. Everybody ran the other way. Even my patients. I tried to get patients to come in and be witnesses for me, and they just said no, that they'd just find another doctor. Of course, this was back in the early 2000s, and they could find another doctor, but now I don't think there are any, and most of my former patients are now deceased. And but yeah, what I did was I tried to go to conferences. I went to a conference in Boston, and that was a very expensive conference trip for me when I came out. But I figured, okay, I'll go to this. It was an American Pain Society. They have since folded because the government went after them. But I went to American Pain Society conference in Boston, and when I, raised my hand and spoke to everybody, most of the people that I talked to when I went to them one on one, they'd say, "Oh, I'm doing everything right. I don't have anything to worry about." And then the few that had something to do, they would come up to me and whisper, "Yes, it happened to me." And they wouldn't come out and be open about it. So, those, and then the problem also with those doctors who have been attacked is the government makes sure that they don't come out in public, because if they take a plea agreement, they are actually gag ordered, so to speak, through their plea agreement, that they can't talk about their case. And then when you have people who are you have lawyers, your lawyers say, "Oh, you can't talk about your case, they'll use it against you," or whatever. So everybody is basically forced to keep quiet, to shut up and not say anything. And so that the propaganda goes on. And I'm now in the process of running my communication campaign on Doctors of Courage. And I sent out my first Facebook post to all of the rising Democrats, so those that are basically trying to win, that are on the Democratic platform. And I put Facebook posts out there, and I had one lady reply to me, "Do you have any evidence of your being innocent, or could you have actually broken the law and not known about it?" And
Well, here's the
so,
thing. Let me address that for a minute. That's a very important point. According to Ruan, it's impossible for a doctor to break the law and not know about it, because Ruan says the doctor must know they are committing a criminal act and choose to do so anyway.
well,
And
that's true for all law. Mens rea is
it
true for
used to
all
be.
law.
It used to be.
Used
And
to
then
be.
they started passing these laws that are, I forget what they call it, but they basically, if they say you did it and they can
Ignorant
convince a
willness or
jury
something
you
like
did it.
that. Something like
Well,
that.
now what they're
Willful
doing to
ignorance.
get
That's it. I
around,
had it backwards.
yes,
Willful ignorance. Yeah.
what they're doing to get around Ruan is they're saying knew, should have known, or was willfully ignorant to what was going on, or willfully blind is what they used in my case. Now, what they mean by willful blindness is not blindness to any written law, but blindness to whatever opinion they want to propagate at your trial. So I'll give you an example. One doctor, they said, "Oh, he used Narcan. That means he knew that patient was at high risk of overdose." In another trial, same expert witness, "Oh, this doctor did not prescribe Narcan," obviously showing that he didn't care if his patient died of an overdose. Well, you're guilty either way, and that's the way they want it. So I would argue that legitimate medical practice means practicing medicine in accordance with the written laws. Is there a written federal law saying a physical exam must be 11 system, 7 system, 5 system? Because as you and I know, as a physician becomes experienced, they can walk into a room, talk to a patient, and tell more about that patient than a brand new doctor or medical student could with a 30-minute exam, right? Mm-hmm. So I believe that they are dictating the practice of medicine, and not only that, but they are criminalizing physicians in not so much a random way, but it is rather random. It's sort of a Russian morning shot. We're going to shoot one, whether they're guilty or not, and that's going to scare the rest. And I would argue it's been very effective, because I don't know. I'm sure you are seeing these pain refugees, these patients who have been treated for decades with the same medication, have been stable on it, and all of a sudden they just can't get medication because of medication restrictions, production restrictions, and because doctors are just too scared. How many of those people have you seen? Are you seeing those people in your practice today?
Well, I don't have a practice.
Well, not a medical practice, but you do
Oh, yeah,
educate
well,
and
just
train
basically on
people.
Facebook,
Yes.
the chronic pain patients that are on social media that talk about it. But then they're not willing to take the steps to change it. So,
And I would argue that that's a problem with the way this has been handled. If if medical doctors had the opportunity or had taken the opportunity to reach out more to other modalities that might help different patients, we wouldn't be stuck where we are now. I think the business of medicine drove each section of medicine into a little walled city where they pointed everyone else as wrong, and we are the only right ones, right? Because I can tell you right now that the addiction medicine people were somewhat gleeful when the pain practitioners started getting rolled up, thinking, we're going to get all those patients. And then when they started getting rolled up, they're like, oh my gosh, what are you doing? This is terrible. Well, the same standards they use to send a pain doctor to prison because their patient chooses to take themselves out of the equation with the medication or chooses to sell one so they can pay their rent. All of that comes back on the doctor. That goes with the addiction medicines also. So you have taken kind of a medication or pharmaceutical free approach, and you've got these other modalities of treatment that you found to be efficacious to kind of, in the end, people always heal themselves. I mean, even when you use antibiotics, we know the antibiotics don't actually, they kind of hold the bacteria still a little bit to give the body time to heal itself. We know that because no antibiotic will save you if you have no immune system, right? You're going to go down. So you've got these courses where you help people learn to live a healthier life and try these other modalities that might help them. And I would argue that that's the only thing that's going to be available to them. And now you believe that the medications are masking the disease to a degree rather than treating it. So when it comes to type 2 diabetes, I assume you would agree that a lot of it could be resolved with diet and
right.
exercise and all that.
Most type 2 diabetics is basically diet, but you can't get people to get off the sugar.
But boy, you can get them to pay $1,000 a month for Wegovy and then look like a concentration camp survivor. I have a friend who used that, and as soon as we FaceTimed, I hadn't seen him in 6 months. Said, "Oh no, 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 no!" I said, "You're on it, aren't you? You're on Wegovy or something like that," because he truly looked like he had aged 10 years. I mean, his hair turned gray, went from brown to gray. His face, it just looks vastly old because to a degree, you're manipulating your hunger urge to starve yourself. And if you don't eat enough healthy stuff, you will age fast and get old. Starving's not good for you. Eating healthy stuff's always good for you.
Yeah.
But the problem is that it knocks out appetite completely. And it's not a good way to do it. We do need some structural components and fuel and all that stuff. Now, how have you maintained your strength? I know that your faith gives you a lot of perspective and sort of a source of comfort that others may not have. But how have you fought so long? Because it's been almost 20 years that
Dr.
you've
Parker,
been fighting this fight.
are you wanting me to start crying now?
No, I don't want you to start crying.
I do every time this subject is brought up. So be ready.
It's fine too. I probably will too.
I don't have a tissue with me. One of the main things that I received after putting Doctors of Courage on the website was doctors that were attacked that basically would come to me afterwards and say, if I hadn't seen your article about me on Doctors of Courage and other people and see this is happening to other people, I would have committed suicide.
Now
I save people's lives.
that is profound. And Dr. Ziman, after he was acquitted, did himself in. And many of our patients, Dr. Bokoff's patients, a husband and wife took themselves out of the equation because they could not tolerate the agony. And I think as physicians, our most fundamental duty is to relieve the suffering of others. And I think most of that is done through the therapeutic relationship, the connection between someone who's suffering and someone who cares about their suffering. And I think that's what these doctors experienced, was to know that someone knew and understood what they had gone through, because we all feel alone when we go through this. And as you say, everybody goes, and you're thinking, oh, I doctors whose careers you help build will say, I don't want to get involved. I'm too scared. I'll be targeted. Doctors will not even, they will go through these CME classes and tell you, don't fire a patient over an unexpected result in a drug screen, because you put them at high risk of addiction and death. And I said, oh, would you come and just say exactly what you said at that conference at trial? Oh, no. I work for an institution that gets federal funding. We think it's a conflict of interest. The truth is a conflict of interest. And when doctors are afraid to tell the truth, I think we're in a very bad situation. And I always relate it back to the Soviet era in the 1930s in Germany, where, quote, starting with good intentions ended up in very bad places. So now people can learn from what you've learned. So having not been able to continue in regular medical practice, you turn to non-pharmaceutical methods, and you've studied these, and you've come up with programs and education that people can take if they want to learn a different way. And I would argue that would be an excellent idea for a lot of people to look at that and see if that works for them, because they're going to have nothing else. I don't think the DEA is going to stop until controlled medications are pretty much banned. You see them going after the ADD doctors now. They're going after, and I can tell you right now, any ketamine clinic had better have a really good attorney on speed dial, because now with the death of Matthew Perry and the head of the DEA going out and saying he got addicted in a doctor's office and he died at home. No, he didn't get addicted in the ketamine clinic. He was at the ketamine clinic to be treated for an addiction that had plagued him all his life. Now, when you talk about addiction, what do you think the fundamental cause of addiction is? And understand, I've studied the genetics of it a lot. And we're just now starting to get a handle on genetics, and there are 15 genes that they associate with a higher risk of addiction in the averted test by Solved Health. And 20% of the population carries those 15 genes, yet a much smaller fraction is actually susceptible to addiction because of epigenetic, environmental, and behavioral differences. And I think that's what you're talking about when you're saying that there are so many other factors that have a much greater effect.
The number one cause of addiction is toxicity. And toxicity is due to our lifestyle. The number one cause of toxicity is anxiety, because anxiety, increased stress in the body, causes acidification. And the other thing, which medical science, conventional medicine doesn't even understand, is acidification in the body. If you get somebody and you take their urinary, do a urinalysis on them, and their pH is 5, most doctors just look at that and ignore it. They have no clue that means that person is very acidified in their body, and that their kidneys are basically really having to overwork to try to remove the acids, and nothing else can come out. That acidity is due to their diet. The 6 foods that are acidifying are sugar, grains, alcohol, proteins, fats, and one more I can't remember. There's 6 things. It's all in my course, I'm going to talk about nutrition. And since our sad diet in America is so acidifying, that's the problem. The kidneys can only remove the acids. The toxins, therefore, have to stay in the blood, and as they recirculate through the body, so that because the blood is supposed to take oxygen, carry oxygen, and so on, and has other nutrients, then the toxins get deposited in the cells. Now, where genetics comes in is our toxins are deposited in the cells based on our genetic propensity. So if a person has heart disease, toxins will get deposited in the heart. If a person family has colon cancer, toxins will be deposited in their colon, and so on. So that's where genetics comes in. So the key is to stop the toxicity, first off, with proper lifestyle. Secondly, remove the toxins from the cells that have already been deposited there, and that cannot be done through anything conventional. That can only be done through homeopathy. And so in my course, I teach about homeopathy, but you need a real homeopathic physician to actually, it takes about 2 hours to really go through a person's history and learn what terrain they are in, or at least what remedies that they need to cleanse their body. But homeopathy is the answer. It is the most scientific science out there. Conventional medicine poo-poos it and says that it's quackery because they can't. No pharmaceutical industry can put a patent on something that comes from an herb or a homeopathic remedy. So all they want to do is put it down, but it is the most important science that there is. It is the most scientifically based. It is the most tested through proper testing done back 300 years ago, and it's basically the answer to the problem. Genetics is also important, which we've only just learned in the last 20 years about epigenetics. That was not even a term 50 years ago, but epigenetics basically explains why cocaine is the choice of most of your Black population. Why? Because 100 years ago, people were given cocaine as a stimulant to work in the fields. So most Blacks now have the use of cocaine in their genetic history. And by using that drug, by their grandparents using that drug, they carry the gene for it. And so it is then, therefore, the answer when they have stress, when they have anxiety, when they have increased reasons for taking something that they need to calm or chill. Cocaine is the answer. And basically, that's where epigenetics comes in. And we are destroying our future generations by giving people drugs now that they're giving statin agents to 5-year-olds. Okay. So it takes 4 generations to get rid of the epigenetics for the desire or need for a drug. So all those kids that are now kids like getting ADHD medicines, well, guess what? Their grandkids are going to want Adderall. Okay. And so that's basically how it progresses. But conventional medicine, because they can't make money on it, they don't believe in it, they don't teach it. In fact, oh gosh, don't get me on what's happening in our medical profession now. If they can't see something wrong on a lab value, nothing's wrong.
Well, that has been taken to an extreme when it comes to pain, because you can show an MRI that shows where, for some reason, they think that if you take a metal rod and screw it into a bone, that's supposed to quit hurting. They say, oh, that I'm saying, no, you've got a metal rod through a bone. Of course, that's going to generate pain in most people, and anytime there's a temperature change and all that. But they are now arguing that you must ignore what the patient says. There must be an objective measure of pain, and we have no objective measure for
Imagine what happened to people with fibromyalgia. There is no lab to identify a patient with fibromyalgia. I can tell a person has fibromyalgia when they walk into my exam room and I look at them.
Now, and fibromyalgia is an interesting thing because they have found about 20 some odd causes of what we would call fibromyalgia. So fibromyalgia literally means kind of your tissues hurt. That's like a headache, right? Calling it cephalgia.
Oh, a total body headache.
You have cephalgia. Well, but what's causing your headache? Did you get hit in the head with a rock? Have you had a subarachnoid hemorrhage? Do you have a brain tumor? It's kind of important to differentiate the cause of that headache, right? A tension headache or a migraine will be very different from a brain tumor causing a headache by pressing on the meninges. So I find I don't deny the diagnosis of fibromyalgia, but it is a descriptive diagnosis. Somewhere there is a deeper cause. And I
Well, I
think
can explain the cause. You need to go on my website, Doctors of Courage. I have the video on fibromyalgia right there. Just
well,
watch it.
and I think that you've hit on something with the chronic stress, because our ancestors had severe intermittent stress, but we suffer from severe chronic stress. It's there all the time in our modern lifestyles. And then the diets that we follow kind of further that stress and don't promote healing the way it should. And so I'm going to put links to everything so that people can look through what you've got available out there. I'm going to make sure when we're talking about your book, it's going to pop up on the screen by the time I finish editing, and there will be a link to it also. And do you see this getting better anytime soon? I'm thinking, unless something drastic happens, you usually see the government will start a program that with somewhat good intentions. Let's go back to prohibition, right? There's no doubt alcohol causes a tremendous amount of damage to people's lives when it's misused. There's also very little doubt that any use of alcohol is like riding a motorcycle. It might be fun, but it's a little dangerous, right? It creates a little toxins our body has to deal with. So they prohibited alcohol, starting with good intentions. And then when those good intentions resulted in terrible bad outcomes, they doubled down. And right now we're in the double down phase. We're still in the double down phase after 50 years of the drug war. Because as things get worse, they use that as an excuse for more funding and to become even more draconian until we are the most incarcerated society on earth. And, China used to have the death penalty for smoking not that long ago.
Yeah.
And guess what? A whole bunch of people in China smoke, including their rebel Mao Zedong, because if the government tells somebody they can't do something, they're going to want to go out and do it. So they finally learned from prohibition. Why is it taking so long? It only took 15 years for them to go from instituting, about 15, 20 years, from instituting prohibition to, reversing it. And that took constitutional amendments. Mm-hmm. It was a constitutional amendment to put in prohibition. It was a constitutional amendment to take it out. Why are we so dysfunctional now that after 50 years of abject failure? Because now when you say to get rid of the Controlled Substances Act, you're not saying that we don't need to have no drug laws at all. You're saying if the federal government did its job and secured the borders, 79% of all deaths would disappear.
No, that's not what I'm saying. I'm saying get rid of the Drug Act totally.
Oh, I agree.
Drug causes addiction.
But
why would we need drug laws but if we got rid of the Controlled Substance Act, there would be no border crisis. Okay? People wouldn't have to, because the cartels would go out of business. People can buy their drugs. So
you're talking about decriminalization similar to what Portugal has done.
No, complete legalization. Decriminalization just means you don't go to prison, but you still can't buy the stuff. Complete legalization of all drugs. They can then be sold over the counter. The people in Mexico can raise the herbs and sell them legally through proper pharmaceutical companies that make them and sell them. There will be no border crisis. There will be no overdoses because everything will be legal. And it's a total legalization, completely eradicate, get rid of the Controlled Substance Act. You'd save all that money chasing all the fentanyl, illegal fentanyl, illicit fentanyl wouldn't exist anymore.
So full legalization with standardization and sort of a civil system, the same way we control foods and all that stuff, where there's There's
It
regulations
it would
on
go through
purity
the
and all
FDA,
that.
right? Everything that would be sold would go through the FDA.
Well,
That's correct. And the way to do it now, we have the opportunity. It's just that whether people will take it or not. Because right now, the Democratic platform is freedom, freedom of
right.
choice, freedom of choice, but they are specific to women's reproductive rights. The thing is, freedom of choice is not a U.S. government jurisdiction. There is nothing in our Constitution that says the government has any right to make any decisions as to what a person does with their body. If they're going to use that argument for reproductive rights, we need to use that argument for rights for what we eat, drink, smoke, inject, whatever it is. A person has the right to do that, whatever it is that they choose to do. Okay. And when that happens, then the amount of anxiety in the country will go down. Basically, we'll solve all the problems, the money issues, the cost of all that we're doing, the time that the Congress is spending looking at all these laws. I have on Doctors of Courage the list of all the laws that are in Congress for just the 119th Congress. I'm sorry, 118th, the one that's we're in now, not the future one. And there's hundreds of laws, hundreds of bills, not laws, bills that they're projecting, that they're proposing to control all of this. Well, all of that is wasted time because none of it's going to control anything.
Well,
So my platform is legalize all drugs because drugs are not the cause of addiction. And then at some point, hopefully, we'll recognize what the real cause of addiction is, and then it can be addressed.
well,
But
that's
it's
the way
to
it
the
used to be, right?
individual, not the government.
Right. I mean, it used to be that way. When this country was founded, nobody would come arrest you if you smoked or drank or whatever something. And cocaine, was legally used in Coca-Cola and stuff like that. And because there was not the incentive to purify, concentrate, and reduce the volume, the problems it caused was very minor. You would have individuals that would overuse it, but you can overuse anything, right? I mean,
Sure.
over-the-counter cough syrup like dextromethorphan, drink enough of it and it's a hallucinogen, right? We don't. It is impossible to safeguard everyone from everything they could do that we would consider perhaps stupidly harming themselves, because then like I say, you wouldn't have motorcycles. There's no reason to have motorcycles except that I loved riding one, but realistically, there's no rational reason for them except people like them and want them. And if you ban motorcycles, you would get into a big problem with people who love them. Same thing with cigarettes. We know cigarettes kill 600,000 people a year, right?
Right.
5 to 6 times more than opiates kill, than fentanyl kills. And those are fentanyl poisonings. People think they know what they're taking. And if they were taking actually what they thought they were, they would not be dropping dead. Those people aren't trying to commit suicide. So they're thinking they're drinking tea and they're getting arsenic or strychnine instead. And even arsenic and strychnine won't kill you in tiny quantities, but right, because they're being poisoned, they are dying. So you're talking about taking us back to before the federal government felt that it had to save us from our own liberties. So right, that would be back to before the Harrison Narcotics Act of 1914, right?
Exactly. And the other thing is freedom of choice. Just because there's a law, as we know from all the people that are taking illegal drugs, just because there's a law doesn't mean people are still not going to have choice. And the same thing is going to be with the abortion. All the evangelical Christians out there that are backing Trump because of the abortion issue. Well, of course, now he's flim-flamming around and not making any statements what he's for and what he's against. But anyway, I mean, they're wanting to vote Republican because they want abortion banned. But the problem is, it isn't going to ban abortion. It's just going to send it to the back streets, to the back where it was in the 1960s, where women literally took their choice of possibly losing their life, going into a dark, back alleyway to a person who is willing to perform an abortion or use a coat hanger or whatever. I mean, it's still going to happen.
Well,
so a person needs freedom of choice.
Is more restricted, has those states have the highest rate of abortion.
Yeah.
And if they get rid of contraceptives like they plan to, so that women will not have the right to control their bodies in that way, you're going to get a lot more unwanted pregnancies. So
Mhm.
I would argue the clandestine abortion rate is going to go through the roof
Mhm.
if they start instituting those things. And we used to do that. We realized it was stupid, and we stopped. And now we seem to be reverting through. I swear, sometimes I think history is repeating itself.
Oh, it always does. Just,
You
I mean,
know,
just look at Israel, you know,
yeah. But
and,
you would hope that
we're
people learn a
repeating,
lesson from the past. That
you'd
looks
think.
really painful. I think I'll avoid that. Just learning a lesson that shouldn't be so difficult. Well,
Yeah.
Dr. Cheek, I really appreciate you speaking today, and I hope that I'll have all these links here for people to go to, and I hope they will look everything over and give it a chance and a read and open their minds to some alternative ideas and thoughts, because there can be no doubt that our current policy has failed miserably, and I would argue that American healthcare itself has become more of a money generating system than
Mhm.
a healing
Right.
system.
And people don't know how to be their own physician. Back when I was a child, I never saw a pediatrician. My parent, well, now there were vaccinations, so I guess we went there to get vaccinated, polio, and I think there was
Well, they did
maybe
that at
one
school.
vaccine in
Remember,
my
they
day.
did that. I got
Yeah,
my
we did that. Yeah, we did
um,
that.
what was
Yep.
it? I've got the smallpox, so if monkeypox comes around, I'm covered. So
Yeah, but we didn't need doctors. Nowadays, people don't even walk out the door without, getting the approval from their doctor. And the problem is, as I see it as a Christian, is we are very possibly on the brink of not having a civilization. And so one of the things that I do with my e-course is actually teach people how to go back to old style medicine, how to treat themselves, how to get away from
mm,
pharmaceuticals, and how they can be their own physician and actually use energy medicine, which is a whole lot better and a whole lot more healthful than pharmaceutical medicine, to heal their body and be healthy. So
now,
that's one of
is
my
this along
goals.
the lines of like Ayurvedic or Chi medicine? Is this Eastern medicine
Well,
influences?
homeopathy is the basis, but then I also use auricular therapy, which you said you didn't know anything about auricular therapy. Auricular therapy is using the hologram of the body, which is in any part of every part of your body is a hologram of all the other parts, and the ear is a hologram of the entire body. And it also
Ah,
doesn't hurt to treat the
heard.
ear. So when you treat the ear, you can get rid of pain, you can get rid of basically any kind of disease that you have by treating the ear. So that's what auricular therapy is. So I teach people with just a simple probe is all you need to probe to find out what parts of the body need healing. And you can energetically then tell your body to heal that part. So I don't do a lot of Ayurvedic. I mean, I do like ashwagandha myself. It's a good adaptogen for everything. Ginseng. I tried to learn TCM, traditional Chinese medicine, but I can swear to you that it would take more years to learn TCM than it does to learn conventional medicine in a medical school. It is very complicated.
It sure is.
Whereas
Sure.
auricular therapy still uses energy, just like acupuncture and a TCM does, but a blind monkey can treat your ear.
And
Okay.
you do use acupuncture, which when I was training at Mayo in 1993, when I started my training there, they had an acupuncture department. And I remember being surprised and saying, "Oh, you have," but they're quite a bit more progressive than most.
Mhm.
So I will learn more about that. I'm ashamed of my ignorance. I'll read up on it, and so I can know more. But I really appreciate all the work you do, how hard you fight for everyone, and how strong you've been through all this, because you have really been through a lot, and to come through it with more knowledge, and the time that they tried to take from you, that you took back by coming out smarter and mentally and spiritually stronger. I think that speaks very well of who you are, and as a model for what other people can do when they find themselves in the same situation, because there's 3,000 of us now,
Yes.
3,000 of us just in the last decade. And I don't think it'll stop anytime soon. Thank you so much, Dr. Cheek. And I hope that I hope you understand how much we appreciate what you do.
Thank you very much, Dr. Parker, and thank you for having me.
Yes, ma'am.